Hey, good morning. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. Delighted to be back with you in this great morning in Kansas City. Good morning, Kansas City.
Yeah.
Hey, we had some fun last night.
Yes,
Both Brady Singer and the Royals. Let's talk about that to start. My gosh, that guy took a no-hitter into the bottom of the eighth. And then, Mondesi's got his bat going again. The Royals have won 3 in a row up in Cleveland. That's some good stuff. And I think there was a football game at Arrowhead that I may have watched. I may have watched the replays, and I may have watched all the post-game and pre-game interviews. And man, it was fun to see some football.
I was raging all night.
I know. I
just rolled in.
Sleep. The Royals. That was great, and awfully fun to see that going again. And I thought the things at the pre-game were great, and so it was just really a special night, and a lot of fun to have that in the midst of this pandemic. So, Dana, you're here with us today. How are the numbers right now?
They're okay. They're okay. Again, anytime we can have lower, that's better. We have 22 today, 4 in the ICU. 2 of those are on the ventilator. We still have 5 people who are considering recovered still on the ventilator, though. We have about 29 to 30 patients who are in that recovery status, so we aren't actively counting them as acute infections. So it's still about 50 patients overall.
It's still a big deal.
Who shouldn't be here, who are here because of COVID.
It's a big number.
Yeah.
We have a pretty big celebrity with us this morning, Amanda Gartner.
Wow.
I think there may even be kind of a cool video out there that we may be able to show just a little bit. Amanda Gartner is the Director of Quality and Safety. She's the head of Infection Prevention Control here at KU. She's one of our best nurses, and she is just a terrific person. I've gotten to know Amanda over the years, and what a pleasure that's been. She is helping us all the time on things and helping people reopen safely, help people stay open safely. And it turns out she is a Chiefs Fantasy Camp Football All-Star. I believe she is in the Fantasy Camp Hall of Fame.
I don't think that exists.
It does now when you're in it. We've just started it. I hope Mark Donovan's all good with that.
Okay.
The Chiefs, but here we go. What are we doing here, Amanda? Tell us what you're doing.
Well, we're learning how to catch a football.
And look, you have gloves on, so I think you already knew.
Yeah. Getting some one-on-one lessons here.
Yeah, how'd your team do that year?
Our team didn't do fantastic.
Okay. So you said that look at you, look at this. What is this?
This is embarrassing, is what this is.
Yeah, what happened there?
Well, what is this?
I don't know what that is. That's a really dorky-looking ghost.
Well, I won some awards that year, but I do think that the ballot was stuffed. I don't think it was actually based off of my talents.
Okay.
But allegedly, the story goes that all the awards came to me, but there's no way that was actually true.
Really
Yeah,
true.
I got 2 real ones. I got 2 real ones. Proof of 2.
Well, so, I played in one of the very first fantasy camps and was the leading receiver because we kind of managed to get Trent Green to be our quarterback in that first fantasy camp and made it all the way to the finals where we were exhausted and beaten by a team that was 15 years average age younger than we were, and Trent threw 3 interceptions. I'd like to blame Trent, but I think the truth is we couldn't move, and so we were just trying to throw the ball and hope somebody would catch it. In the meantime, we had a lot of fun. What a great thing. And last night was not a fantasy camp. In fact, you notice before this week we've had Fauci, Patrick, and I'm bringing back coronavirus with a mask. And by the way, I believe I got this from you in infection control. Coronavirus with a mask, a lot of fun with that one. But Patrick's taking a little nap. We're going to let him recover, so he's not up here this morning with us, even though
we'll get Patrick
But
back.
he did great last night, right?
He did great.
3 touchdown passes.
Oh, that was awesome. How about that rookie? He was awesome. How about the defense? They looked great. That was a team effort, huh?
Yes, very
Really?
good.
My son was happy. He has Edwards Hilaire on his fantasy football team, so he was happy.
He did look good. All right. Well, we know there's going to be a lot of questions we have out there today, so we should probably get to some of those because this is Question Friday. So, Jill, do you want to start us out?
Sure. Do we have any media?
Oh, yeah. Any media questions today?
Hi, it's Taylor at Channel 41. How are you guys this morning?
Hey, Jared. Welcome back.
Taylor, hey.
Hey, I wanted to ask about, again, touch up on the breathing things in versus contact and touching things, because I'm curious specifically about fogging businesses right now. We're seeing more of those pop up where people are fogging places of people's homes, people's businesses, that kind of thing, to clean them up. I just want to ask about the efficacy of fogging right now, if that's the right thing, if there are ways that it works and ways that it does not work, and how important it is still for the surface cleaning to be part of what we're doing. Thank you.
All right. Well, this is perfect that Amanda's back on the program. I think she needs to be here on most of these Question Fridays now. By the way, that's news to you. I just thought of that. But, fogging I've known about for mosquitoes, but fogging for surfaces.
So there are environmental disinfection processes that involve kind of a fogging type process. What we know from COVID, though, and the transmission of COVID, is that it really is more person to person through the droplet transmission. So good standard regular cleaning protocols are really the ones that we've been advising all along, and I don't think we have any evidence to suggest that it would necessarily be worth it to invest in a fogging type cleaning or more advanced cleaning. Really just any EPA approved disinfectant cleaning surfaces that get touched by multiple people is really probably the best practice, and then anything you can do to prevent the transmission through the droplets.
And so I'll just say out to my family, that just means wash the dishes and clean your car. You still have to do that. So really not, and we've been saying that for a little while, Dana. We're not sure that this is really a surface disease. We do think it's like Amanda's point, this aerosol, our droplet.
Yeah. Now, when I am in environments such as the hospital, or I go to the store, some things of that nature, I assume that there could be people who are ill. Now, certainly the mask barrier helps disperse virus, protect from you dispersing virus into the environment or landing on surfaces. So I think the mask culture is helping with that. But if the virus is on a surface and I am touching it, I'm also being very wary that I'm not going to be touching my hands to my eyes, my nose, my mouth, and I'm going to use adequate hand sanitizer. So can it still be on the surface? Absolutely. Is it the major way that it's spread? No, it's more of the close contact. And again, hopefully with everybody wearing masks now in a lot of the stores, in the restaurants, if they are infected and don't know it, and they are expressing virus into the environment, it's going to be blocked by the mask, and it's not going to land on those high-touch surfaces. So I think just regular routine cleaning and disinfectant products, just as Amanda said, are good enough. It can land on surfaces, it can be on fomites or inanimate objects, but it's probably and is not actually the major way that it's spread.
Yeah, so I think we feel safer about that than we did. So let me ask you guys both this question. Will you shake somebody's hand?
Yeah.
Yeah, I mean, I think there's no reason why you can't shake somebody's hand. You can always wash your hands before, you can wash your hands after. There's really no reason not to.
If somebody is ill and they are coughing into their hand, I'm not worried about the virus on my fingertips per se, on my palms, because I know that I'm going to be doing adequate hand hygiene. I'm not going to be touching my hands to my face. Yeah. So I would.
And especially based on the duration and exposure, I mean, the duration of the exposure and the intensity of the exposure data that suggests severity of illness. Yeah. I think, really services, you're just not going to get that. That's a one-time quick event. Whereas if I'm around somebody's breath cloud, that's a different story.
Yeah. They have studied knuckles are less contaminating than handshakes, and then obviously the elbow tap is even
Leave it to the infection control person to come
They've
up
done
with
the
that
studies.
You were up late reading that.
Yeah, there we go. Okay. I was watching the Chiefs game. Next, no, we got to get to any other media questions. And did we answer yours?
Yeah, I think so. Like I said, I'm just curious about, because there are people spending money on that right now, and I don't hear you guys saying that's a waste of money necessarily. I'm just curious about, is it worth it if I own a big business and have people coming in that I'm able to say, listen, we fog regularly, that kind of thing. Is that any better than saying we have a professional cleaning company come in, that kind of thing?
Yeah, and I wouldn't say there's a preference one or another. Again, my recommendation would be using standard cleaning practices. Yeah. And really, if you don't have the money to invest in a fogging, then I don't think it's necessary, really.
I think the real answer to that is wear a mask.
Yeah.
Do all that. That's great. You want to do that stuff. That's an elective procedure. Kind of like the people who fog their backyards for mosquitoes. That works great until mosquitoes come. And all of a sudden, I still get bit. But I think that the real key in any business is people need to be wearing masks, and there is no substitution for that. Other media questions? All right, I'm not hearing any, so we're going to get to our questions that have accumulated over the week from our listening audience.
All right. When can someone who currently has COVID-19 get the flu shot after isolation?
That's an interesting question, Dana, and as I listen to it, it's kind of wrapped up into some other points about it. So let's talk a little bit about what you're thinking about flu shots right now.
So we had our influenza vaccine task force meeting this week because we are preparing to roll out our screening questionnaire and also giving vaccines to our employees and our patients here at the health system. This was one of the questions that came up. I also did pose this to one of our vaccine experts here at the health system, Dr. Kevin Alt. Did get a very good response. The actual CDC has addressed this as well. For the most part, you want to wait till the acute illness is done. So what does that mean? So probably you're going to be starting at that 10-day point, 10 days from symptom onset. You still want to make sure your symptoms are improving. You want to make sure that you are fever-free, but it's probably going to be at that 10-day or further time point from when you have the acute illness. If you want to push that to 14 days, that can be better as well. But that's what it is. And if that is what really what they are talking to when they refer to isolation, because I'm assuming it's isolation, meaning that you have the infection, it's really going to be probably that 10 to 14 day or after from your diagnosis or your symptom onset.
Okay, thoughts?
No, I completely agree with Dana. We've been asking the question, and I think that's the best guidance that we know. Obviously, if you are still suffering from a fever, it wouldn't be a good time to get a flu shot. And I don't know if we should talk about it now, but I know there was a question earlier in the week about sometimes you get the vague symptoms of flu after a flu shot. So you might have a fever, you might have some muscle aches, you might have fatigue, and so I think the question was, well, those are very similar to COVID. Should I go into quarantine?
Yeah.
And I think that first probably 24 to 48 hours after you get a flu shot, that would be an anticipated symptom following the vaccine and not a reason to suspect that you have COVID. So I think you would probably monitor it for 24 to 48 hours before thinking, oh, wow, could these symptoms be from something else?
Yeah, exactly. I think that sounds good. All right, so next question.
Yeah. Recent news reports say that at least 9,200 healthcare workers nationally have died of COVID-19. How can you say hospitals are safe?
Yeah, that's a great question. And, we try to get these the day before we get them. So I was reading a lot last night after the Chiefs game and try to figure the right answer to this question out. Well, what we can say about healthcare workers who have passed away, first of all, an inordinate amount of those occurred early in the pandemic. And that's at a time when we didn't have the right PPE. I think places like New York and Seattle and others were a little overwhelmed by the volume and the intensity of the number of patients, and things were not we just didn't know as much. I think if you look at the more recent statistics, when we've got all of our infection prevention control plans in place, when we really understood how the virus is transmitted better, and when we had appropriate PPE, the number of deaths has dropped dramatically. Also remember that people who are healthcare workers are also people, and they tend to go out and act in the community like people. And in many of the cases, in fact, most of the ones that we've seen in our own institution, we believe, and I'm going to turn to my two experts here in just a moment, most of the folks we believe in our community here at KU who have gotten it, our healthcare workers, really we think have had a community origin and not a hospital origin.
Yeah.
So I think that those are really important points. So yes, healthcare workers die from COVID. Of course, there have been almost 180,000 deaths in the United States already, and we're still not that far into this pandemic, so we can easily anticipate that number is going to be in the 300 to 400,000 or more range before we're through with this. And so it's not surprising that healthcare workers or any kind of frontline worker who are frequently out in the population and doing things are going to be some of the folks who this disease takes a toll on. But also remember that everybody's out in the community, and most of the cases of COVID-19 amongst our employees, we believe to be community spread.
Yeah, and I would go further to say, I don't know of a case where we have an employee who has acquired the infection from taking care of a COVID-positive patient. I don't have any indication that that has happened. So instead of just saying most, I think all of
Yeah,
our
yeah.
employees have had either a community onset is really what we're suspecting.
And that's something we've worked hard to look at. just to
Absolutely,
say.
and we look critically at every employee that tests positive. We do just like with any other patient, we would do a contact tracing, a very thorough investigation. And if we have maybe one or two people on the same unit, we look into that even further to make sure that there was no relationship to taking care of the patients.
Yeah, and I think to your point, healthcare workers are people too. There was just a very recent study from CDC that shows you are probably 2 times likely to have gotten COVID if you've gone out to restaurants compared to other people who they looked at who, if you weren't otherwise a contact of a known case, if you go to a restaurant. So people are out there doing that. We know it's in the community. We have other very good published reports, some early from China showing extreme decreases in their rates of healthcare worker infection once they started instituting PPE. Mm-hmm. We know that there is a very good study out of clinical infectious disease looking at 2 academic medical centers, and their seroprevalence, meaning when they went back and tested healthcare workers for antibodies to COVID-19, their seroprevalence was lower in the community for those healthcare workers compared to the community around them. So we have, a growing base of data.
That's actually really good.
Yeah.
Really good proof the healthcare
Yeah.
workers say. So think about that. So now let's turn this question on its head for just a minute. How many healthcare workers do you think would be infected if we didn't use masks?
Oh,
Mm-hmm.
I think we wouldn't be able to control it.
Right. And that's the point we're making, and I'm going to stick to the point because we're right and it is true. Masks make all the difference.
Mm-hmm.
And people who don't believe that mask wearing help are just wrong. You're just wrong. We know it in the operating room. We know it here in the hospital. We know that masks control the spread of COVID.
Mm-hmm.
So would you ever have a surgeon not have a mask when they're operating on you?
Of course not.
No, no. Why are we fighting this fight? This is an absurd fight.
I do have a question for you.
You go.
Won't this be fun? So how do you think, because we know influenza is transmitted very similarly to COVID, how do you think, because if we are truly in the mask culture, how do you think it will impact our spread of the flu?
I think influenza is going to be a lot lower this year. And I got my fingers crossed, but that's the Australian experience as well as the South African experience.
Yeah, absolutely. We know that the
Very
mask
much.
culture here in the United States, depending on what community you live in, is a little bit different than others. But hopefully, and from what we do have in the governmental published reports from South Africa, from Australia, from the other independent published reports, these steps to mitigate the risk and spread of COVID-19 have seemed to positively affect the spread, or actually negatively affect the spread of flu, meaning it has decreased influenza cases. What are the reasons exactly for that? Who knows? Are people not wanting to go to the doctor to get visits and get checked out? But the calls to emergency departments and clinics and all that are down as well for influenza type illnesses. So hopefully all these things that we are doing, and as we can continue to endorse our message of masking, not meeting in large groups, physical distancing, that will also help decrease the spread of influenza as well.
Before we go to the next question, Betsy has a follow-up to your topic right now. She wants to know if you're testing the staff that work on the COVID units. And yes, if yes, why? If no, why?
So we test our employees just like we would a patient. If they have demonstrated symptoms or have a concern about whether their symptoms are associated with COVID, then yes, we do test them. We're not doing any prevalence testing or surveillance testing or screening, though,
But
for our employees.
Your point about what the CDC said is really important here. So it has been looked at, and the seropositivity, meaning your antibody level, if you're a healthcare worker, being exposed to COVID is actually lower than that in the general community. And there's only one reason for that.
Yeah.
It's PPE,
Yeah, it's
right? It's good
And
infection
that's
control.
been shown in other countries.
It works.
Like we said, China, once they were able to institute those PPE things, they did see that their rates in general for healthcare workers were lower than in the community.
It fascinates me. We're still fighting this fight about whether masks are important when it's just so obvious. And we've known it in healthcare for so long. And guys, we're apolitical about this. I don't care if you're Republican or Democrat. This is not a political question. This is a healthcare question. You wouldn't want your surgeon doing an operation on you, standing over you, or the nurse, or anybody else in the operating room standing over you, breathing on your wound and inside your body. That just doesn't make any sense. It just gives me the heebie-jeebies to even think about it.
And I think people would ask, well, why haven't we done this forever? Well,
Then which part forever?
the masking.
Yeah.
So because these other diseases, the common coronavirus, rhinovirus, these common colds, influenza, don't cause the devastation that this has caused, with the ability to infect so clinically efficiently as it does, the ability to make even healthy people, although obviously if you have comorbidities, you're more at risk of disease, even healthy people ill, so many people ill, missing work, destroying supply chains, having people, first responders, very important positions, not being able to staff fully because people are out ill. But we should look at what happened in China and Asia with SARS. They started their mass culture, in 2002 because of what happened. We are just quite a few years behind that. So that would be a reason why we haven't in the past done it. Now moving forward, I don't see anything that will rescind this mask culture or mask wearing, especially in the healthcare system.
Yeah, I think in the healthcare system, masks and a more extensive use of masks is here to stay.
Yeah,
and
I
it should
agree.
be. Yeah, and that's a good thing. That's going to keep everybody safe.
Why do COVID-19 patients get all the attention? Why can't I get in to see my doctor? I need health care too.
That's a really great question, and to some degrees, it is a heartbreaking question. Because I read this last night, that the reflection on this is that people are having a harder time getting in to see their physician, and that's a problem. Here's what I can tell you at the health system. Our average wait time to get to see us is actually down. And it's the impact of telehealth.
Yep.
Our total visit volume is up by 10% from this time last year. So we're seeing 10% more patients now than we did a year ago before COVID, and it's all in telehealth. So my heart goes out to the person who asked this question, because what I can tell you is, at least at KU, our next available time, because we've added telehealth and we've worked at adding so many clinic times to make sure we can take care of COVID and our general population of patients, it's actually down, and yet we're seeing, and as a result, we're seeing more people than we ever have. And I think that's something we've made a decision about to do. I hope that other healthcare providers or others will follow suit. Keep trying, keep working. You'll find people out there. The other thing just to say is there is a primary care shortage in the United States, and that you may be experiencing some of that as well. If you're trying to get in at least primary care, we know that there aren't enough primary care physicians in either urban or rural areas. Specialty care often a little bit easier to get into, but keep trying. Keep trying, and I'm sorry you're having that experience.
Yeah, and I'm not sure, because it has been so important. We have continued to endorse the message. You need routine care. You need routine screening for cancer. We had on, two oncologists yesterday how important cancer screening is. We've also talked about how children need their routine pediatric vaccines, and even adults need their vaccines. So we have been really, out front and talking about how it is safe here to come here, and we want everybody to come here for their routine medical care to stay healthy and do those preventative things. So it's really difficult to know exactly what that circumstance was, and I would say just keep taking it up the chain to really try and get in, because we really do open up spots, and with telehealth, that helps to be able to see you. And it is important to get cancer screening and vaccines.
And this listener may be from not even part of our health system, who
Right.
knows, but I do think that that many places have been pretty busy. The other thing that has happened is that with the new requirements for infection control in clinics, most places are not able to see as many patients as they did before. So we've tried to address that through telehealth and extending hours and other things, but that has made it harder. Now, you're safer when you go, but it has made it harder, and that may be some of what that person is experiencing.
What is the percentage of younger people who will now experience long-term conditions from COVID-19? Is there data?
You know, there is today, but
Yeah.
that's because there was an article about it yesterday.
recent one,
Hawkeye,
yeah.
and that's going to help us answer that question. And you know, in looking at that, there are 6,000 to 7,000 people who have died of younger ages, and that again, that was just published. It represented that the death rate in the hospital was about 2.8, almost 3%. And another 3% of people who are young went to long-term care facilities because of chronic issues with their lungs, their heart, and other things, so they weren't recovered enough to even go home. So, Hawk, I bet you've seen some of that.
Yeah, that was a very good article. It was, recently published, just looking at the younger age group. So I believe it was 35 and under, 18 to 35 or so.
Yeah.
Looking at that age group, or even younger, and just showed that there was still a high percentage of those patients that went to the hospital. And then there was a small percentage, just as you said, 2 to 3% that went to critical illness and death. And then the other percentage of patients that went on to having more chronic, needing long-term care facility to rehab themselves, to get better. And we know in general that once you have this disease, some people can have lingering symptoms for 60 days, 90 days as well, such as cough, fatigue, malaise, just not feeling good.
And some people may have permanent lung injury and not recover, or permanent cardiac injury. We have people who have an ejection fraction, and that's how much blood your heart can pump out with each beat. Some of those folks have had long-term heart issues, and the lung, if you have progressed to having fibrosis and scarring of the lung, that's not a reversible process. It may improve a little bit. By and large, those folks can have a permanent disability and be on oxygen and even have to get a lung transplant. So, and if that's available to you. So you have to take this really seriously, no matter your age.
And I think it's important to acknowledge, too, the folks that don't have COVID but have been impacted by the pandemic. So school-aged children and even the higher education, not being able to have that socialization, what does that have from a mental health perspective, or even intellectual health going forward, which we don't know what the impact will be.
That's a great point, because the mental health aspects of this are very real, and we know that the calls to the suicide prevention line were up 8,000% early in the pandemic, and we know that that's a national story. It's not just a local story.
If a coworker attended a sporting event with hundreds or even thousands of people, should they quarantine?
Okay, we're talking about Arrowhead Stadium sporting.
Yeah, so I think we know that KDHE has mandatory quarantine guidance if you have attended a large venue. So the recommendation that I would say is, yeah, the best thing to do would be to quarantine.
Yeah, I would agree, based on the KDHE.
What's large?
Theirs was over 500. Now, they may modify that a little bit and say you can go to a large event, but if you can't socially distance at the large event, that's when you should quarantine.
Right.
Because if you go and you're able to socially distance, which I was watching the game last night, and I think some people were very well socially
Some
distanced.
people did better than others, yeah.
But they show those shots of the crowd, especially in the fourth quarter, not as much mask wearing as there was in the first quarter. I'm just going to say, and plus it was raining, so the mask may have gotten wet, and people were a little more congregated. But I think still they're outside, so hopefully everybody will be okay. Got my fingers crossed, because the crowd still made a lot of noise at that game last night.
They
I
did.
think you're probably right. If you're going to be around a crowd and you can't adequately distance, and especially if you have it unmasked, you got to quarantine for 14 days.
I'm hoping to visit family. Should I get a COVID-19 test? How soon before I leave?
Oh boy, this is one we tackled this
So
a
many
lot.
layers.
Yeah, there are a lot of layers to this. Okay, who wants to take the first shot at it?
Well, I'm happy to acknowledge if you don't have symptoms, if you don't have a reason to suspect you were exposed to COVID, you probably don't need a COVID test. And again, what are you planning to do with your family? Are you going to maintain social distancing? Are you going to wear a mask? If you are, if they're distanced from you, if they live far away and you actually have to travel to visit them, they're not likely in your bubble. So although they're family, you might have to take on those additional precautions to protect yourself and to protect them.
Or what have you been doing for the last 10 days? Have you been trying to isolate yourself away so that you know that you won't be exposed, so that when you go visit? But, your initial answer is correct. As we move forward, the hope is that there will be more accessible testing for everybody whenever they want it. whether that is more capacity to do the NP or the nasopharyngeal PCR, or whether that's saliva testing for PCR, or whether that's the antigen test. Ultimately, we would like to do that, again, to get the data of really how much disease is out there and where is it spread. Right now, though, I would certainly agree with Amanda that we don't recommend, if you otherwise aren't a contact, if you haven't had symptoms, there's probably really no reason to get a test.
I think the other question I would just say is that a lot of it will depend on the health of the populations that you're moving into and out of. Because if you're going to go visit your elderly parents who are have some health risks, and then I would say, gosh, you better have been really careful and sheltered for a couple of weeks before you go, or maybe better you could think about a COVID test in that setting as opposed to somebody who's
And
really
if you
healthy.
do, I would not do it any more than 48 hours before you leave. I think after that, it really becomes probably null and void, any result.
Yeah. Okay.
All right, I've read articles that adding baby shampoo to nasal rinses immobilizes the virus. Is that true?
Amanda?
I have certainly not seen that anywhere, so I'm not familiar with those articles. I don't know if Dana, if you've picked up on any.
I would not recommend putting any detergents like that into your nasal passages or rinses or anything like that. These are all anecdotes. People are looking to also use mouthwash. You know, I certainly think they probably could destroy the virus. I don't think if you are infected with the virus, you are replicating and pumping out so much virus, your upper respiratory tract is your cells. Anything you do really won't matter. Certainly, at this point in time, there is no evidence to suggest that it protects you or it's a treatment for COVID-19.
This sounds a little harrowingly like using Clorox underneath your skin or taking Clorox tablets. Bad idea. This is a bad idea. And to Dana's point, you actively shed virus, and even if you use some baby shampoo, if you were to kill all the virus at that moment in your nasal sinuses, it replicates and it's throughout your respiratory tract. You don't want to get baby shampoo into your respiratory tract. It's going to be right back into your nasal sinuses again, and you'll be shedding it within moments. So I would say, no, don't do that.
All right. Why has the KDHE started reporting COVID-19 outbreaks on their website? How does this help?
Yeah, that's a great question. We should probably bring Lee Norman back to fully answer this question and things. We'll see what you guys think. But I think one of the problems has been that many places have been reporting these outbreaks. KDHE had not done that. It's also a way for people to know where the outbreaks are, and so that way you can have some avoidance. So I think that might be the reason they're starting to do it. Unfortunately, I think it's become a little politicized. And again, if you just step back and look at it and say, okay, can this be an important tool for people to know so they don't go to places where those outbreaks may be? One could argue that could be true. I think that, again, other states have done this for a while, so this isn't really a novel concept. It's novel to us. And I think the real key is educating public about what it means. I'm a little bit more concerned about just pushing that information out there with a whole bunch of education to go around it, an explanation about what that information means and how long it's a current for and what that means people should do.
Yeah,
Thoughts?
and I agree that it's a pretty common public health strategy to let people know where are the concerns, what can we learn from those locations, what are they doing, what are their behaviors, and how can we prevent the spread, and then also letting people know, oh shoot, I participated in something in that area, maybe I'm now a concern, and depending on the size of the outbreak, either you've been a member of that contact tracing group or maybe you need to be. So I think it can serve a variety of purposes, but I think having Dr. Norman on would be a good idea.
And I think it helps with transparency. You know, there is a lot of disbelief of the pandemic in general. There's a lot of distrust of the government or other larger entities. So I think this is one more step to help with transparency.
Can we squeeze in a related question from Suzanne?
Please.
From this morning. She says that her husband was exposed to the virus last Thursday, so more than a week ago. Wednesday, day before yesterday, he had a negative test. She wants to know, is he good to go?
Is he good to go? Okay. Well,
So
there's actually,
6
we know
days?
the statistics that he's had 6 days. So that's what, 70, 75%, right?
Yeah.
6 days is a little early to be giving a test.
That's what I was going to say, is that I think we don't know yet. There's a chance that test was negative because it's too early in that cycle.
Yeah.
They haven't started shedding virus because it can incubate for up to, as we know, around 10 days. And so really we say 14 days after exposure
Yeah.
before you really know.
Yeah, people can have positive tests one day after, but we have always said, and not we, but really, the CDC, the guidance, KDHE, you can't really test out of quarantine because we know the incubation period is 14 days, and that has really been what has been consistent from day one as well. So you really can't test out of quarantine. You would expect probably by then you could have tests positive 7, 8, 10 days. However, testing positive at negative at 6, 7, 10 days does not negate the need for you to quarantine for 14 days, unfortunately, because of the incubation period.
And what we know is that, I'm trying to remember the numbers here, but the further you go, a negative test has greater negative predictive value. But if you do it at 6 days, I think it was around 60 or 70% of the
It's
time.
right in the middle.
Yeah, I don't think that still means you got a 30 or 40% chance
Oh, yeah.
of being falsely negative because
Yep.
the virus hasn't finished incubating in you yet. So.
All right, is it true that a small proportion of infected people, 10 to 20%, are driving 80% of the new
Ooh, the
cases?
super spreader question.
Yeah.
That's really what this is, right? What do you think, Hawk?
I don't have a good idea for that percentage, but what I can relate it to is, just as you said, the super spreader or the super spreading event, whether that's a wedding or another party or something of that nature, somewhere where there's a large gathering. So that could certainly be, I don't know if it's just an individual go out there and spreading it as a super spreading person. I think it's more related to the events that you're at and the amount of people within those events.
Yeah, I would agree with that. And I think as it's been presented before by Dr. Wild, and I can't remember the exact website, but you can actually look at the counties that you're potentially going to identify what that likelihood of somebody within that 50, 100, 150, all the way up to over 1,000, the likelihood of having a positive person within that group. And unfortunately, the smaller groups in or counties all around the country, the likelihood is becoming closer to 100% all of the time, that there's at least one person in that group who's positive.
Here's what I would say too. Remember that how COVID-19 is spread. It's spread by your breath cloud. So if you have a lot of people who are closer together, the breath clouds are closer together, and you're walking through it and you're in them more and longer. So it's not so much a super spreader individual. I think it is super spreader events from which certain individuals emerge and can take it and spread it, in part because they go to another super spreader event and they're asymptomatic. And then if you couple those things closely together, that's where this really can take off. Now, relative percentage, I think that's going to be something we can figure out years down the road. Right now, I think that's hard. But just remember, your breath cloud that's the answer. We try and invent all these other that's why Fauci tells you to wear a mask. That's why the way you take care of this dang thing is to wear a mask. Mask that coronavirus up. Because it's that breath cloud. You've seen it when we've been in the freezer before. I thought it was going to be cold enough this week. It really didn't get quite cold enough to really see your breath very well. Yeah, there it is. Do it again. Do it again. Look at that guy with the mask. You don't see a breath cloud. Watch him. There it goes. And that's because he doesn't even have it over his nose. Look at all the stuff that goes out and just sits there. Do you want to walk through that? I don't want to walk through that. What a terrible idea. As soon as it turns cold outside, you'll be able to do your own breath cloud analysis, and you can see how far it goes, and you'll be impressed. And then you just sit there and you watch it hang out for a minute, and you're like, yeah, this is what people are walking through. That's where the virus is living. It's living in that breath cloud. And so if you're exposed to it for a while, especially in close quarters where the breath cloud can't disperse, that's when you're going to get the coronavirus.
But even the most recent one of the most recent news reports about that wedding with 65 people led to 140-some cases in nursing homes, prisons, at least 3 deaths. So, we see these all the time. That is one of the more recent ones where you have a few people that are together. There's probably 1 or 2 people there that are infected, don't know they're infected, spreading the disease, and then it just blossoms into...
Well, the best example of that was that original biological meeting in Boston.
Yeah.
That we've now been able to analyze because we've been able to track it for so long, where I think 80 out of 130 people, there was probably 2 or 3 people who came
Yep.
Close quarters, sitting together at lunch, very early in the pandemic, before
Yeah.
we really had a great understanding of it. They were all close quarters, and then so 80 people came out of that meeting sick.
Yeah.
They were a lot of them asymptomatic. Then they got on planes, and then they flew back all over the country and all over the world, and pretty soon that event multiplied so many times because people weren't sheltered.
Yeah.
They're going to restaurants and they're doing the things. And then, let's talk about restaurants. Data yesterday comes out. People at restaurants, and you mentioned it earlier,
Yep.
have twice the likelihood.
Yeah.
So, it's all about that social gathering.
Yeah, and I think it really stresses the point that it doesn't matter if it's a 100, 500, 1,000. It's just as risky if you're in a group of 5 or 10 if you're
Right.
not taking those appropriate precautions and they're not
Exactly.
your normal bubble
Not your
group.
nudge, who's in your
Yeah.
bubble.
Amy Christine has a bonus question, and then we have 2 final questions.
Okay.
Amy Christine
We gotta
says that-
rock through these guys.
Yeah. Family in St. Louis, they have 3 that have tested positive. Is it presumptive that the 4th person also has COVID?
I mean, I think it's going to be dependent on the type of interactions, degree of exposure. So has that family member been within close proximity? Have they been interacting like they normally would? And if so, probably it's those behaviors that we would want to link to. Or if they've maintained a social distance, have they been wearing a mask? Have they been isolating? Have the positive family members been isolating from this 4th family member? So I think it's not a 100% yes. I think it just depends on what behaviors and interactions and level of exposure has happened in that household.
Yeah, I mean, but I would think if there's symptoms, I think you would probably have to, take precautions to protect other people. So maybe assume at that point, if they're symptomatic. Otherwise, kind of going back to what Amanda said.
Okay.
Our next to last question, what is sticky blood caused by COVID? What does it do? Does everybody who gets COVID get sticky blood?
Great question. We know that blood clots are a common problem, especially if you're hospitalized, and that
Yeah.
sticky blood can cause problems to your organs like the lungs, the heart,
Yeah.
kidneys, liver, and others. So we can give people blood thinners for it. And eventually, as the disease phase and the inflammation phase, the stickiness begins to fade. But I think we still give the anticoagulation for up to 6 weeks.
We do, yeah. People do leave the hospital on anticoagulation. We believe that there is direct damage to the blood vessels by the virus. There's also the collateral damage from the immune dysregulation causing an increase in the thromboembolic or the clotting or the sticky blood process, which causes those blood clots. So, it is a very real thing. Does everybody who get COVID get that? We really don't know. We know that it can happen in a high proportion of people. We know that it can happen in people who are severely ill, and we know it can happen in people who don't ever have to seek medical care, but then come to the hospital 2 to 3 weeks later with blood clots. So there's really not a lot of other information based on that, but we know anybody could be susceptible to that.
Final question, is it true that COVID-19 will go away as soon as we hold the election?
If only it were as simple as a date coming and we could just say it's over. I think as we've talked over and over that we're reliant on a successful vaccination or vaccine development and then deployment of that vaccination. And I don't see that coming in, have any relationship to a election at all. I think we have to really rely on our scientists to do their due diligence to get a good vaccine and then make sure that we are in the community able to get it deployed. And I don't think it has anything to do with the election.
Yeah, what's more concerning to me is if there is a push to get a vaccine out before it is truly ready and vetted by science, looking at safety and efficacy. We already know, as we discussed, there's a lot of distrust and disbelief out there in the government, in the pandemic. There's already distrust about vaccines. We need to make sure that the vaccines are studied correctly and that when they are ready to be rolled out based on the science and data, then they can be rolled out. It shouldn't be based on a date, just as you said. So I would absolutely say no, there's no truth that the virus is going to be gone. The pandemic will be gone as soon as the election is gone.
We try to be honest in this program. We try not to do any flapjacking where we flap our arms and jack with the truth. We just try and tell you, we try to tell you this is what's going on. Viruses do not care what political party you're in. They don't care what country you're in. They don't care what state you're in. Viruses don't care. The way we stop a virus is because we care about each other. And there's no better way to show that than to wear a mask, because that's the best way to say I love you. There is no way that the election is related to the end of this virus. I know there are some conspiracy theories out there and people who think that. They're just wrong. The truth is that the virus is real. Infectious disease is real. This is not the first time there's been a pandemic in the world. Influenza was the H1N1, AIDS, others. Pandemics are real, and that's what happens throughout history of man and mankind and the animal kingdom and anything else. Pandemics are real. And what we have to realize is that we can keep each other safe. And the way we do that is we take care of each other. And the way we take care of each other is we follow the rules of infection control, which travel with you wherever you go, whatever party you're in, and whatever date it is on the calendar. That's what's important, because that's how we take care of each other. Hey, Monday we're going to talk about looking at different types of tools to help us know about school openings, which are underway now, as well as different parts of society. Dr. Kenny Southwick, who's the Executive Director, Cooperating School Districts of Greater Kansas City, will be with us. So we'll look forward to that. We'll also look forward to some pretty cool masking, but first, an important announcement about the Community Blood Center. They're needing donations. There are some type of blood types that are down to about less than 2 days again. I think we heard this morning O negative is especially in short supply. So please be a donor. Remember, it's another great way to say I love you and I want to take care of you. To find a drive near you or to learn more, go to that savealife.org. I think I got the right website, but if you just Google the Community Blood Center, you're going to find it. Send us your mask photos, and remember to send us the reasons. We're looking for 50 reasons to wear a mask. I could sing 50 ways to leave your lover, but you don't want me to do that. Hey, coming up are some pictures from our surgical ICU here at the health system. We want to thank the Patrick Mahomes Foundation for buying them lunch. Paris, Becky, Sarah, Natalie, Darby, Tanisha, Kara, Ashley, and Phil rooted the Chiefs while maintaining the pillars of infection prevention and control. We know the real reason that the Chiefs won is yesterday I had my Chiefs red tennis shoes on. You all saw that on the program. Had nothing to do with offense, defense, Mahomes, or Edward Solaire, whatever he said his last name. It had to do with red tennis shoes. And if you believe that, you're going to believe that coronavirus will go away after the election. So remember, give us a call if you have any questions. Please let us know. We're here to try and help. And until Monday, remember, there's a great way to stay safe. Wear a mask, and there's still no place like home. We'll see you Monday.